or 7.
Okay, that is perfect, yes. Hello and welcome to our monthly webinar on public health. My name is Said Mehboob Shah. I'm professor at the Institute of Public Health, College of Medicine and Health Sciences, United Arab Emirates University. This webinar is part of the global campaign, This is Public Health. We are very proud to be affiliated with ASFAR, the Association of Schools of Public Health in European region. In this webinar, you will be able to ask questions. You can do so by clicking on the Q&A in the middle bottom of your screen. So I would like to first invite Professor Adnan Haidar Ali to share a few words before we start with our seminar. Professor Haidar Ali, the floor is yours.
Thank you very much, Professor Mehboob. On behalf of George Washington University's Milken Institute School of Public Health, I want to thank UAE University and particularly the Institute of Public Health and particularly Professors Michael Grivna and Syed Mahmood Ali Shah for the warm collaborations between our respective institutions. I'm delighted today that we have the opportunity to participate in your webinar series. And I'm particularly pleased that my colleague, Dr. Nino Pachadze, will be providing a conversation and a talk on something that is very important to us, which is the role of industry in public health, defined as commercial determinants of health. I do want to emphasize that a number of colleagues around the world have been working on this issue of commercial determinants of health. And here at the Milken Institute School of Public Health at George Washington University, we decided nearly over a year ago to establish a dedicated center on commercial determinants of health. Dr. Paichadze is the associate director of the center and leads us in a team of work that is exploring research, looking at implications for policy, and also trying to uncover how particularly those industries that are harmful to health affect public health. We are also extremely interested in building our collaborations around the world. And so I'm particularly pleased that Dr. Grivna and Dr. Shah and their colleagues are in close conversations with us on how to build our collaborations between our respective institutions. So I hope that you will have the opportunity to listen to Dr. Paichadze and engage in dialogue, not only today, but I also welcome further interactions after today, both in person, on social media, have a conversation, and hopefully the implications of these commercial determinants, you all will work more in your region and in your countries in the Middle Eastern region. So thank you very much again for this collaboration. I am very, very interested in hearing the talk. And once again, Dr. Syed Mehboob Ali Shah, thank you for coordinating and moderating. Much appreciated.
Thank you very much, Professor Adnan. It was really very nice, and we are blessed with this collaboration because this is such an important problem in this region, and how we can collaborate and address these issues, that is important. So we are very fortunate to have with us a wonderful professor, Nino Paichadze, who is assistant research professor in the Department of Global Health, Milken Institute School of Public Health. In the George Washington University, she completed her medical training from the State University of Georgia, and also she holds Master in Public Health from Johns Hopkins Bloomberg School of Public Health, and her research focuses on non-communicable diseases, injury prevention, digital health, and particularly research capacity development in low and middle income countries. Her today's session will focus on the commercial determinants of non-communicable diseases, a global challenge. So welcome, Professor Paichadze, and the virtual floor is yours.
Thank you so much, Professor Syed. Thank you so much, Dr. Haider. Hello, everyone. It is my great pleasure to be here today. I think with this, I'm going to start sharing my slides. Just 1 second. And we'll start from there. Here we are. Everybody can see my slides, right? Okay, so in today's talk, in this webinar, I want to give a brief overview on commercial determinants of health. Just talk briefly about the definition, but just first of all, set the context and talk about the definitions, but also give overview of some of the tactics that these corporations use and that are harmful to health, population and individual health. So in terms of context, we need to talk about NCD burden. Based on the GBD 2019 study, there were more than 46 million deaths caused by non-communicable diseases and injuries globally. And over 75% of these deaths occurred in low and middle income countries. Many of you know that NCDs have very complex and etiologies. They're multifactorial. They're multifactorial, and they're determined by many social, individual, political, cultural, economic, but also commercial determinants as well. The risks for many of the NCDs and injuries are associated with production, marketing, and consumption of commercially produced foods and drinks, such as, for example, those that contain sugar, that contain salt, trans fats, but also we need to mention tobacco and alcohol here. In terms of global trends, what do we see across the globe is that unhealthy commodities such as snacks, soft drinks, processed foods, their consumption is growing very fast in low and middle income countries. While in the past it was considered the problem of high income countries, this trend is changing quite rapidly. It is projected that at the current pace of increasing consumption, the levels of consumption of such unhealthy products will converge in high and low and middle income countries quite soon, within the next 2 or 3 decades. Since the size of population in low and middle income countries is already 5 times greater than in high income countries, the bulk of consumption is already coming to low and middle income countries. The situation with tobacco and alcohol follows the same trend. It is interesting to mention that it is really projected that tobacco and alcohol consumption will decline in high income countries. And we can talk maybe during the discussion why it is so. This trend is very different, is going to be very different in low and middle income countries, where the consumption of tobacco as well as alcohol, in addition with snacks and soft drinks and processed foods, is projected to increase quite rapidly within 5 or 7 years. It is projected to occur faster in several of the low and middle income countries. I would say fast developing countries such as, for example, Vietnam, India, where consumption is projected to double. But there are countries like Egypt, China, Tunisia, Cameroon, Morocco, where consumption is going to increase by more than 50%. Multinational companies have already entered food systems of several of middle-income countries to the similar degree as in high-income countries. And we need to also acknowledge that studies show that in countries where there is high consumption of tobacco and alcohol, there is a high consumption of soft drinks and processed foods, which means that there is a direct correlation between consumption of one type of unhealthy commodity with the consumption of different types of unhealthy commodities. The correlation of these products with unhealthy foods suggests that they share underlying risks associated with the market and regulatory environment. This is very important to consider in today's world. When we're talking about commercial determinants, it is impossible not to mention globalization. It is one of the key drivers, and what it is, this is the internationalization of trade capital as well as information flows. High degrees of trade openness as well as global media access allow multinational companies to reach more customers with their marketing messages and their products. The effect of trade on health have been studied for a long time by different researchers, but there is still very little known about the impact of global capital flows on health and risk factors for NCDs and injuries in general. So why do we think? I really do think that this is a global challenge. So reversing the high burden of NCDs, and I did not provide a lot of slides on the burden because I believe this is it's a topic for a completely different seminar or webinar altogether. We know that the burden of NCDs as well as injuries is rapidly growing, and to reverse this high burden of disease, such as cardiovascular disease, cancers, respiratory illnesses, mental diseases, diabetes, as well as injuries, this is a global challenge. The latest estimates by World Health Organization indicate that approximately 80% of all deaths worldwide are attributable to NCDs and injuries. Nearly half of these deaths occur prematurely in individuals of working age. The 2030 Agenda for Sustainable Development Goals recognizes that NCDs and injuries are a major challenge for sustainable development. Many of you know that there are 2 specific targets, target 3.4, which calls to reduce the premature deaths from NCDs by 1/3 by 2030, and target 3.6 that calls for halving the number of global road traffic deaths by 2030. This has been amended recently. So in NCD prevention, an emphasis is quite often placed on individual and personal lifestyle choices, and responsibility is quite often placed on individuals. Many of you who work in this area would agree with me, but we need to look at this from a different perspective as well. This approach ignores that many people have very limited control over their circumstances and their exposure to marketing activities or other tactics implemented by large transnational or multinational corporations. Health is not only determined by individual or genetic factors, but by also socioeconomic context, the environment people live in, including income levels, as well as educational standards. Such corporate activity as marketing of harmful goods, including unhealthy foods, sugar-sweetened beverages, tobacco, alcohol, also affect health. Corporate activities share our environments and determine the availability, promotion, pricing of such products. We are more than 5 years post SDG agenda, and it is very important for the public health community to acknowledge the threats that come from corporate sector. Now, let's talk briefly about commercial determinants of health. The term itself was first coined by West and Marteau in 2013, and they provided this definition that commercial determinants of health are factors that influence health, which stem from the profit motive. It was in 2016 when Professor Ilona Kickbush and her colleagues revisited commercial determinants of health, and they expanded the definition by giving us the following, that commercial determinants are strategies and approaches used by private sector to promote products and choices that are detrimental to health. In the literature, there are several other terms that are often used interchangeably with commercial determinants of health. For example, corporate determinants of health, or quite often we call them profit-driven diseases, and also we can see quite often the terminology like corporate practices harmful to health. Professor Freudenberg describes corporate practices as the business and political activities of corporations. These practices result from companies' decisions about the production, pricing, distribution, and promotion of their products, and from their political efforts to create an environment favorable for their business. I believe while talking about commercial determinants of health, it is very useful to revisit the definition and a little bit go through the purpose of the corporation itself. So we do have clear understanding what is their real goal and purpose. The term corporation is generalized, and it's a broader term. Quite often you can say, like, for example, the government, the church, the school. So corporations are run by human beings, by individuals. The corporation itself is inanimate and it has no human attributes. The corporation is just a legal device that exists for the sole purpose of providing the greatest possible financial return to owners or investors by making profit. And these are usually small groups of owners and executives or institutional shareholders. So I usually like to highlight this purpose and goal of corporation when we're talking about commercial determinants of health. So what is the relationship between corporation and public health? Quite recently, maybe a decade or so ago, a new perspective was introduced to the public health field, that the corporation is a distal micro-level social structure that influences the health of the public, and that reform efforts need to be directed at the corporation as an institution itself. So why we're talking about corporation, while we're talking about commercial determinants of health, because we have, we public health professionals, policymakers, some policymakers and researchers, we have some concerns about the corporations. So what are these concerns? There are too many main concerns. First, in the absence of strong public spheres and the imperatives of a strong democracy, the corporation that usually lacks self-restraint does not respect the human values that are not commoditized, but that are very central to a democratic civic culture. Second, the primary purpose of the corporation, as I mentioned earlier, is just to increase the shareholder value by increasing their profits. It has no other obligation to an individual, to a society, or to the planet as a whole. When corporations, it is, many of you know from business field that corporations exist in a constantly competitive environment. So it is competitions that competition in the marketplace that drives corporations towards increasing profits, which are often achieved through the reduction in costs, through cutting wages or salaries or benefits, or through polluting environment. Competition can lead to extremes in human behavior that can result in unethical, greedy, and risky management decisions to keep the corporation active or competitive in the business. Another term that we quite often see when we talk in the literature, when we talk about commercial determinants, is industrial epidemics. It has been used to describe health harms that are associated with various goods, not only tobacco, alcohol, or processed foods, but also cars or motor vehicle industry, as well as vinyl chloride, asbestos, gaming industry, and many others. In industrial epidemics, the vectors of spread are not biological agents, just like, for example, in infectious diseases model. Unlike that, these corporate disease vectors implement sophisticated campaigns to undermine public health interventions. So this is why here I want to briefly go through the epidemiologic triad, which many of you will be familiar with. The triad consists of an external agent, and we have a host, and we have an environment in which the host and agent are brought together, causing the disease to occur in the host. A vector, an organism which transmits infection by conveying the pathogen from one host to another without causing disease itself, may be part of this infectious process. A classic example of a vector is the Anopheles mosquito. Let's look at this now. Can the same model or epidemiologic triad, could it be applied to a disease that is not infectious? Let's consider a smoking-related disease. If we consider that smoking causes disease, those who manufacture, sell, and distribute cigarettes are vectors, bringing the disease-causing agent to the susceptible host. So why do we want to display this as a diagram? Because when looking at the diagram, it's easier to identify some potential areas for interventions. Let's say clean indoor air legislation, advertising potential harm from smoking, or establishing a workplace smoking cessation programs. These types of interventions could change the environment and reduce the exposure of host to an agent. If we look on the other hand, if we see an increased advertising from cigarette manufacturers or increased number of vendors that sell cigarettes, all of this would increase exposure to the host. While talking about commercial determinants of health, I think it's impossible. I'm talking about corporations. I think it's very fair and it's impossible not to pause and talk about positive contributions that many corporations have. For example, through their primary activities, such as the discovery and development of medicines. Even nowadays, during the COVID-19 pandemic, we all of us have witnessed the nonstop 24-hour work by large pharmaceutical corporations that have tried their best to develop vaccine in the fastest time period possible. So it is impossible not to acknowledge this, right? Indirectly, they can also produce some positive contributions through their philanthropic activities, or maybe through a growing number of public-private partnerships. What is important when we talk about positive contributions and when we talk about corporations and their work is to understand, do our political and economic arrangements maximize the benefits that the corporations bring to humanity and minimize the harms? So this is important to understand and think about. Here I want to pause for a second and just lead to my next section, where I want to very briefly, because this is an extensive topic, just highlight some of the tactics of corporations. So what are some of the practices that corporations use and that are harmful to health? Corporations use a large variety of tactics, such as political, finance, public relations and advertising, products and services, legal tactics. This is just, I think, one of my favorite classification of tactics, but some people, these could be used interchangeably. Many corporations use them at the same time. And you can see in the literature slightly different definitions of the tactics. So I'm going to introduce one tactic at a time, and then I'm going to try to provide a few examples of sub-tactics under each tactic. Let's start with political tactics. There are numerous and very varied political tactics available to corporations, which often undermines the democratic rights of people. The larger corporations' revenue and the greater the regulatory pressure, the greater will be the corporation's political activity. The examples of some sub-tactics, political tactics, include lobbying, most importantly, participation in hearings, campaign contributions, revolving door personnel or advocacy, grassroots mobilization, nurturing and exploiting political ties. Let's briefly look at the lobbying as one of the sub-tactics of political tactics. Corporations lobby to, why do corporations lobby? They lobby to gain advantage over competitors or to prevent being disadvantaged, to increase governmental protections, and to increase government subsidies. Corporate lobby of Congress, for example, here in the United States, has grown to become a huge industry by itself, with thousands of lobbyists and millions of dollars spent by corporations. This is very noticeable if you live in place like Washington, D.C., where I do, especially near downtown area where there's this huge proliferation of all types of lobbying agencies. So I looked at this study, which is quite recent, was published last year in 2020 by Wouters, who analyzed publicly available data on campaign contributions and lobbying in the US from 1999 and 2018, and they looked specifically at the lobbying activities of pharmaceutical and health product industry. The study found that the pharmaceutical and health product industry spent over $4.7 billion US during this time, which is an average of $233 million per year on lobbying the US federal government, $440 million on contributions to presidential and congressional electoral candidates, and almost $877 million on contributions to state candidates and committees. So usually they target, these contributions were targeted at senior legislators in Congress that involves drafting health laws, and state committees that opposed or supported key referenda on drug pricing and regulation in this country. Just a few more examples on political tactics is that, for example, to undermine tobacco control research, the US Tobacco Institute promoted partnerships with scientists. They hired researchers and disseminated health promotion strategies to mislead the public about the harmful effects of smoking. Like tobacco industry, food and drink industry develop customers as young as possible using tactics such as early childhood promotion schemes. Submiller and International Center for Alcohol Policies, they have assisted Lesotho, Malawi, Uganda, and Botswana governments to write their national alcohol control policies. The analysis of these alcohol policies reveals that 4 draft documents were almost identical in wording and structure, and it is likely that they originated from the same source and were designed to serve industry's interests at the expense of public health. Another quite often cited example is the Sugar Association that threatened WHO that it would lobby the US government to withdraw its funding because WHO's strategy on diet, physical activity, and health highlighted a strong link between sugar and NCD risk. The second tactic is finance tactics, and they use different types of sub-tactics, which include avoiding taxes, corporate influence on universities, business associations, and corporate foundations, as well as subsidies to corporations. As a researcher, I am very interested in looking on corporate influence on universities. In typically, universities have traditionally held the societal role of objectively discovering, transmitting knowledge, and engaging in discourse to foster democracy, freedom, equality, and a reduction in human suffering. But quite often corporations, corporate foundations, their officers, whether former or current officers, they make large financial contributions or gifts to support universities. Sometimes they focus on business goals that can thereby influence their philosophy, their research agenda, what type of courses they're offering, as well as available facilities for education, as well as some sporting activities. Spending cuts to federal funding for research grants has led universities to turn for funding to corporations. Through such grants, corporations control research agenda, thus giving researchers quite less flexibility to pursue research that may not have an immediate commercial benefit. There is a lot of research in this area, which has shown that corporate interest can drive research agendas away from questions that are most relevant for public interest. And there has been a lot of calls for more effective measures for managing these commercial biases. The studies have confirmed that research results are biased in favor of particular product when the research was funded by corporations that produces such product. Such biases are deleterious at the level of individual research study, as well as have adverse impact on research topic areas, research agendas, individual research, but also institutions such as universities. The next tactics that I very briefly want to talk is public relations and advertising tactics, which PR has become a huge industry by itself. So PR efforts are a means of influencing opinions or perceptions to create goodwill or favorable impression or viewpoint of the company or industry. And it does not always involve direct payment for promotional material. The purpose of PR is much broader than just directly promoting sales of corporate products. Its purpose is to shape perceptions about the corporation, its mission, its goals, and its operations. And examples of sub-tactics include spokesperson, corporate news, the corporate junk science argument, and of course, advertising. Just briefly about advertising, and I'm bringing an example from the United States and specifically motor vehicle industry. In the 90s, the US auto industry spent over $9 billion US dollars on advertising to make SUVs or sport utility vehicles its best-selling and most profitable vehicles. For example, Chrysler employed medical anthropologists to help them design SUVs and then to help them advertise and sell them. The anthropologist suggested that Chrysler design a vehicle that appealed to customers' unconscious reptilian instincts for survival and reproduction, and to advertise SUVs as both protection against crime and unsafe drivers as a means to escape civilization. Unfortunately, these SUVs pollute 47% more than do conventional cars, have higher rates of rollovers and pedestrian driver deaths, and SUVs contribute to an estimated 3,000 preventable excess deaths in the United States each year. In terms of advertising and corporate slogans, as I said, here are some of the examples slogans, advertising messages from motor vehicle industry that illustrates this appeal to human desires. For example, dreaming, Honda, the power of dreams. Or from Jaguar, don't dream it, just drive it. Dodge Ram, grab life by horns. We have even from Volkswagen, out of love to automobiles. Feeling and pleasure, BMW, sheer driving pleasure, and of course from Toyota, oh, what a feeling. As you can see, all of these slogans are developed to really appeal to human desires. The fourth tactic that I want to talk just briefly is product and services tactics. Many public health professionals have been involved in campaigns in which they have taken action to confront corporations about their unsafe or unhealthy products, services, policies, or operations. In doing so, they may have been faced with corporations respond with tactics such as product modification, corporate physical location, product targeting at vulnerable populations, manipulation of scientific research and information. For the sake of the time, I'm not going to go into the sub-tactic here, but if we have time towards the end, I'm happy to talk, to introduce one study that looked at marketing to vulnerable populations such as children. And last, we have legal tactics, which includes liability, take on their opponents, avoiding taxes again, corporate trials and junk science, corporate dominance of international organizations, including United Nations and its affiliated agencies, using the Constitution, unregulated activity and preemption. So while talking about all of this, we need to pause and think about the collective harm. The harmful consequences of corporate marketing are even more apparent at a macro or a higher collective level. Marketers are only interested in catering for the needs of those who have money. Target markets have to be accessible when they're expanding to these markets. They need to be responsible and, above all, viable. The key aim is to reach people with persuasive marketing campaigns and make sure that they will be both willing and also able to purchase their products, which ultimately results in exacerbation of inequalities that damages health and well-being of rich and poor at the same time. And they therefore market to stakeholders and politicians in a bid to influence the policy and agenda and undermine public health resources. However, the biggest effect on public health comes even farther upstream at a planetary level. In the system with continuous growth fed by marketing-driven excess consumption by already well-off is coming into conflict with the limits of finite planetary resources. So while the need for a global collective response and policy coherence across sectors to effectively hold the commercial food, beverage, and alcohol, tobacco industries accountable for public health outcome is clear, the question we need to ask is how, and this is I would say, quite natural question. And when we think about how, we also might consider some additional questions about it. So now I'm going to pause and just before we move to the last section, very briefly, where I want to talk about the governance models that exist today for commercial determinants of health. Here are these three models of involvement of commercial sector in global governance for health, and it presents the relationships that sits at the core of how we achieve goals of improving population health through reduction of exposure to commercial determinants of health. These models include self-regulation, co-regulation through partnership or public-private partnership, and public regulation of private sector. So let's briefly introduce self-regulation. This is an industry-operated voluntary self-regulation and is the default approach and favored approach, of course, of corporations and the UN. It is argued that market forces driven by informed individual choice correct for negative results caused by high consumption of unhealthy commodities. We can, of course, discuss this, talk about this a lot. The second model is public-private partnership, based on the belief that association with industry leads to greater success and does acting independently of them. Also, the argument against this approach is clear for tobacco and alcohol. The situation for food and drink industries, as well as car industries, is a little bit more complex. There are a lot of supporters of the view saying that, okay, people need to eat and drink, and they will also add that not all processed foods are unhealthy, and that partnership with industry might lead to reformulation of some products to less unhealthy compositions. There are a lot of public-private partnership examples. For example, a 3-year International Diabetes Federation and Nestle partnership that was formed in 2012. There is little evidence showing, though, that public-private partnerships deliver health benefits, and many public health professionals argue that they are just delaying tactic of the unhealthy commodities industry. And the last, third model that we have in today's world is regulation and market intervention. This model recognizes the conflicts of interest between promotion and protection of public health, and the corporations that profit from unhealthy commodities. Because growth in sales, turnover, profit are the main goals of transnational corporations, supporters of public regulation believe that self-regulation and working with industry are ineffective and at some point counterproductive as well. Most advocate statutory regulations analogous to those used to control firearms or road traffic, drugs, and tobacco. So what is needed here? This is just a summary of my thoughts here. In order to achieve the ambitious NCD goals that we have through sustainable development goals, we need to adopt a new approach to governing commercial drivers, which contribute to this rising burden of NCDs and injuries. Building on the range of analysis and proposals already made, the international community must urgently envision and design a more robust architecture and support processes for accountability of NCD prevention. We need to ensure that a strengthened multi-sectoral governance platform has the power to provide oversight of private authority, as well as engagement as appropriate. It is critical to prioritize funding and promote research on the effects of corporations on NCDs and injuries. And of course, we should not forget about accountability based on human rights and principles of ethics. Our team here at the Center of Commercial Determinants of Health is actively working on these issues. Here are the examples of two of our latest publications where we try to look at some research agenda in this area, as well as my colleague, Dr. Paul Ndebele has led this amazing work on ethical exploration of commercial determinants of health. With that, I'm gonna stop here. I think we have a few minutes for question and answers. If anybody wants to ask question directly, please raise your hand, and I'm sure you can be given the microphone, but otherwise I'm happy to go through the Q&As, or if Professor Sid wants to ask any other questions. Any questions? I think I see one hand. Anas Bendak. Ismail, could we give them floor to ask the question?
Okay, sorry, I have a question. Can I ask one question and then other?
Of course, of course.
Also, you know, in this country, particularly in UAE, one of the huge problem is in children. You know, the focus of industry is children and young children. And, you know, we recently conducted a study on young children aged 6 to 11 years, young children. Mm-hmm. And we found that metabolic syndrome prevalence is 6%. But when we look at those overweight, obese, and normal, the prevalence is 24% in overweight and obese, and only 1% in normal. So which has a huge, you know, message for future generation and our future health in this country. So I was just wondering, because as you know that 73% of NCD risk factors start in childhood and adolescent.
Absolutely.
And so if you could kindly highlight, you know, how these commercial determinants are impacting this population.
Thank you so much, Professor Sid. This is a very good question, an important one. And you're very, very correct about many points that you raised. First of all, that a lot of a lot of chronic diseases or NCDs, they have their roots in terms of behaviors in the childhood and adolescence, because once you get used to unhealthy behavior, it goes through your life, so to speak. That's why it's very important from our perspective, from public health professionals, to be very careful and pay additional attention to children and adolescents. Now, if we flip this side and we look at how corporations and marketers look at children, for them, children are also very special populations. There is this example about branding to children that you can see in one of the most frequently used textbooks in business schools, where they're saying directly that children are the most important customers or target population for marketers and corporations for several reasons. First, because children, quite often they have their own money, so they can be their own individual free customers. Second, because they have influence on the choices of what their parents gonna buy or purchase for them. And third, they want to make sure that, the children as young as possible are becoming their own customers, so they can have a long lifeline of devoted customers. So you're quite right. For both corporations, children are very, very special population in terms of targeting them, but also for us, because of this and because of the inherent nature of the risk factors that develop in childhood, it's a very important population that we need to work with. I see another question here. Shall I read it out, or
yes, please. Yes, please. Yes.
From NS, what's the role of government in your opinion? So this is a very good question, and we can talk about this and discuss it a lot, I would say. But I think that government has a big role at the end of the day. Of course, it depends on the governance structure or the structure of the state. But from my personal and subjective opinion, governments have very, very important role to play in governing or managing corporations, at least managing their tactics and making sure that, as I said earlier in my presentation, that the benefits that corporations produce outweigh at least the harms that they're producing. And this is important because they produce harms not only on an individual or societal level, but also on a planetary level. Okay, I see another question here. Or does anyone want to talk? I'm happy to hear anybody's question, or I can answer the ones that is posted in the QA section. Can you highlight the pathways and how public health communities can influence political system to prevent NCDs? Well, Mohammed, thank you so much for the question. This is a very good question. So there are several ways of doing this. First of all, I think that in public health community, what we need to do, we need to just pause and think about the current or existing systems or approaches that we're using in managing NCDs. We need to understand that not all NCDs or not everything that we have in NCDs is caused by individual risk factors. We need to consider that it has much more upstream causation model. So we need to rethink our approach, I think. We need to also just rethink how we're approaching NCDs, maybe just tackling as a whole the corporate sector rather than just going by alcohol, by food, by guns or motor vehicle industries. And of course, in terms of influencing, we need to rethink how we do our research. It is very important to make sure that we advocate for much more funding from sources that are not related to corporate sector, to make sure that all our research fundings are free of bias. In terms of a political system influencing them, I guess from conducting research that shows the harmful effects of the corporations and their tactics and their products, showing cost-benefit analysis of different types of interventions, for example, taxation of sugar-sweetened beverages, taxation of alcohol products and etc. I think through this research and advocacy, we can have some influence on political systems. Of course, that's a very good point, Mohammed. Yes, as I mentioned, the main concern is that in countries where the democratic systems or state systems are not as well developed as in high-income countries, and when I talk about high-income countries, I quite often prefer to give an example of, for example, Australia or Canada or New Zealand rather than United States, because I truly believe that based on the research and what I see, those governments and systems, they've been trying to address this topic of commercial determinants much more proactively than, for example, in the United States. So in countries where we don't have such well-developed system, the threat from commercial determinants is even higher. So it is like low and middle income countries, as I mentioned, for example, in several of African countries, it was alcohol industry, and they're funded third-party organizations that supported the governments there to draft their alcohol policies, which is absolutely unacceptable. Okay, another question, how can we situate commercial determinants of health in the known social determinants of health framework? So this is a very good question, Wafa, thank you so much. I know that there are many people who would like to put commercial determinants in the social determinants of health framework, but I, as a person who works specifically on commercial determinants of health, I prefer to have it as a separate field. Just like we have many other types of determinants, it's not only social determinants, we have political determinants that influence health and public health. We have legal determinants, and there is ongoing a large study or large effort looking at specifically legal determinants. But if we look at intersection between social and commercial, of course, we can see that. In social determinants, we can put it in the environment section, but I would say it's not gonna be completely, how to say, honest or fair towards commercial determinants of health.
Oh.
Okay. One question is to Dr. Hyder, I think, here.
Dr. Nina, I think there are some participants who are raising their hands. I don't know if they want to open their mic. They can.
Please.
There's Ines, Pendak, and Swapna.
Go ahead. I'm happy to hear their questions.
And there are two questions in queue, and perhaps you can see one is from Arslan Beg about what are the key policy recommendations for government from low and middle income countries like Pakistan?
Mm-hmm. That I think they addressed it to Dr. Hyder.
Oh, okay.
Well, or shall I answer what are the key policy recommendations for governments from low and middle income countries like Pakistan?
Nino, you're welcome to address it. I'll just jump in and say that I think that the implications here are quite profound. I think that what Nino's talk has demonstrated, that industry is very, very smart. And what the industry does is through the tactics that you demonstrated, Nino, they get the power of influence. And they like that power of influence, particularly over policymakers. So the classic case is that alcohol companies become great friends with the Ministry of Transport. And when the Ministry of Transport and Ministries of Health want to do legislation against drink driving, they have a huge problem because now they are friends with the alcohol industry. The alcohol industry supports their social programs. The alcohol industry provides room, board, travel, and things like that to these government officials. And then it becomes really difficult for, and we saw that in Vietnam, where the original alcohol policy was extremely strong and robust. But by the time the policy that got passed, that was much, much weaker because of this influence. And so, Arslan, I think the key here is to increase sensitization, increase the discussion and conversations around commercial determinants, develop local capacity to understand and absorb these issues, and then mobilize the public health community to really raise their voices against these influences and make them transparent, expose them for what they are, which are true conflicts. But I'm sure, Nino, you can add to that.
I completely agree with you, Dr. Hyder. That's absolutely true. I think in terms of what are the key policy recommendations for governments like Pakistan regulating the multinational corporations. I think, as Dr. Haider mentioned, just looking at the evidence, just making sure that they address all the tactics appropriately. There are a lot of good practices that we know from high-income countries, for example, on tobacco use, we have on alcohol use, on taxation of sugar-sweetened beverages. I think these are the areas where they can start moving forward. But most importantly, I think they need to be very cognizant of engaging with corporations. I know it's differs from country to country. For example, in China, it's very hard to talk about alcohol industry when we know that government has high stakes in the alcohol industry. But to make sure that they are not allowing to be manipulated with corporations through either their tactics or their produced research and evidence.
Okay. There is one question from Professor Gravina, that how can private corporation be persuaded that social responsibility should be included in harming health?
Well, thank you so much, Professor Gravina. There are many of the corporations throughout decades, they have developed these social responsibilities activities. And it varies from sector to sector, but there are a lot of questions about how effective these are. Recently, just looking at, for example, one specific industry, I would mention gun industry. It came to my attention that they are hardly ever using any social responsibility campaigns or activities. And I saw a lot of papers from researchers calling them to implement such activities. Of course, at the end of the day, it's better if they have social responsibility activities rather than not. But we also need to be very careful in understanding how they are using these social responsibilities. Are they only used to really cover up their tarnished reputations, or do they really mean to produce some kind of benefit to individuals and societies?
Okay. Any other question?
I think there is one question about, can you give us some models where governments are very successful in dealing with corporations at different levels? I think, unfortunately, I don't have that one example or like the straightforward response, but I think because, as Dr. Haider mentioned, corporations are very large. First of all, they're very rich. They have a lot of financial resources, which means that they have resources to hire the best of the minds in everything that they are doing, but they're also very powerful. So, and they're using a diverse array ways of affecting the health and different tactics. I think that there are examples of different specific government policy in specific sectors. For example, we can talk about alcohol in the UK, we can talk about maybe car industry in a different country, but as a whole, I think what matters is to make sure that they're not interfering with just policy making, or they're not directly influencing the production of policies, programs, or interventions in a country. I think it's a very good question, and it requires a little bit more analysis and thinking, but I don't think that there are such really determined examples of governments that can deal. But of course, those that have robust systems. But even so, like, for example, when you're reading about, you can compare United States, you can compare Australia, and then you can compare, for example, European Union, where governance structures are very different. So for European Union, where you have different levels of regulations, corporations have adopted very different tactics of dealing with different levels of regulations. Okay, so Mohammed has, yes, Professor Sen.
Okay, I had just one question. Again, yes, in this country, it's a unique country again, that 80% of the total population are migrants. And we conducted recently a number of studies, and then these NCD risk factors so rapidly increase that, for example, this country is known for high rates of type 2 diabetes. And then migrant population who live here for more than 10 years, they have similar rates, similar prevalence. So any work done in USA, particularly in migrant population, to address these issues? Commercial
well, that's a very good point about the NCDs, and we can directly look at the influence of commercial determinants and the prevalence of NCDs, especially in low-income migrant populations. You can talk about either tobacco use, you can talk about alcohol use, but also people who are not able to afford raw or organic or fresh produce or fruits and vegetables, but who are just surviving from day to day using more nutritious and cheaper fast food products. So I think there's going to be similarities, or are similarities among such populations in different countries. I hope I answered your question.
Yes, thank you very much. So is there any other question?
I think I see one from Mohammed Al Sadiq. What policy interventions are available or possible for the poor developing countries to counter the influence of transnational companies, which possesses the money and the influence, etc. So thanks so much, Al Sadiq. I think it's a very important question, and it's also not very straightforward to respond to, given what you also mentioned in your question. Partially, your question contains some parts of the response as well, that transnational companies, they possess money, they have influence, and this is even much more outlined, and it's much more palpable in low and middle income countries with limited resources. I think it's what the governments can do. Again, they need to make sure that they do not rely on corporations and their support in terms of money, in terms of resources. Make sure that they are not involving corporations in their own policy makings, rather than rely on the evidence produced by independent researchers, independent institutions, and then make sure that they are free of the influence of corporations. I know it's very hard in poor countries, but I think there are still some ways, if there is a political will, and we have seen in many areas like tobacco industry, in this tobacco sector, using different types of interventions. We have seen over the decades that they're working. I think slowly these types of poorer countries, they should move forward implementing best practices in their own countries.
With this, I would like to thank very much from our today's speaker. It was such a wonderful presentation, and there was a lot of thought-provoking, questions arise from this presentation. And we're really very grateful for Dr. Adnan Haider Ali and your presentation. And we hope that we will work together on these issues addressed in this country with your help and support. And I would like also to thank our staff members who helped us for this webinar, and the College of Medicine and Emirates University, who gave us green light to and supported the organization of webinar. And I will also like to thank our staff, particularly Al Sajir and Ismail, who helped us to organize this, and our colleague Dr. Ifat Al Barazi, who helped us, and our administrator Shamsal Shamsi. They have great contribution to make this event a successful event. And thank you all for participating in this. And I hope that you will be again participating in our next seminar, which will be hopefully by February 17, and we will continue this discussion. So thank you very much for your attendance.
Thank you very much. It was great.
Thank you.
Pleasure.
Bye-bye. Thank you.
Bye-bye.
Bye.
Okay, thank you very much, colleagues. It was wonderful for your kind support and help.
Thank you, Professor. Have a good evening.
You too.
Assalamu alaikum.
Assalamu alaikum.